They told you, with your personality, with your hair, with your hijab, with your skin color, with your preferences, with your gender. They told you, with their silence, with their words, with their resentment, with their absence. They told you, you don't belong. Yet, here you are.
Hi, my name is Tess Momini. I'm a final year medical student at University College Dublin, and I'm the president of the UCD Surgical Society.
Hi, my name is Habab Iraqi. I'm a recent medical graduate and a foundation doctor from Sudan, and I also serve in EA's administration portfolio.
Hi, my name's Ellie Priestman. I'm a fourth year medical student at Bristol University. I'm also the ASiT Equality and Diversity Ambassadors co-chair, as well as being the vice president at the Bristol Women in Surgery Society.
Hi, I'm Michael Okocha. I'm a general surgery registrar in the Southwest, and I'm the Association of Surgeons in Training Equality and Diversity Officer. I really hope you enjoy this episode of 50 Faces of Surgery. I hope that it leaves you feeling valued, inspired, and most importantly, welcome. Here I am.
Dr. Farah Roslan is a core trainee in Northampton General Hospital. She initially started her medical education in Malaysia before moving across to the UK for her clinical years. She's well recognised for introducing the first disposable headscarves in the UK and has appeared on BBC News with the aim of making surgery more inclusive to Muslim women. For her work, she was awarded Foundation Doctor of the Year and is core trainee representative at her current hospital. Beyond her work in hospitals, Roslan is also committed to improving equality and diversity, as she is a committee member of Inclusivity and Diversity of Association of Surgeons of Great Britain and Ireland, as well as working closely with the British Islamic Medical Association on dress codes. She is passionate about her research with multiple presentations, audits, and most recently, she has published a paper about opioid prescription at post-operative discharge. Thank you for joining us this evening.
You're welcome. My pleasure.
And so I was just going to kick us off with something nice and light. Can you please take us through your morning routine?
Okay, right. So as a Muslim, also as a surgeon, wake up very early. So Muslims pray 5 times a day. So I start my day with the morning prayer first, just as the sun rises, about 5 minutes. And then I will usually go through my diary, just in my planner, just prioritizing the things that I want to do and I want to become. So going through a to-be list and also to-do list. Yeah, and then obviously have breakfast and walk to work. Yeah.
That sounds like a really energizing start to the day, I have to say. So my next question for you is, where did you grow up?
So I spent most of my life in Malaysia. I was born in Malaysia, quite a small town called Seremban, just about 1 hour down south from Kuala Lumpur, which is the capital of Malaysia. And then I did, like just how Elias rightly introduced, I did A-levels and then pre-clinicals in Malaysia. And then I transferred to University of Nottingham, where I graduated and then started work as an F1 in QMC, which is the Queen's Medical Center in Nottingham itself. So yeah, Nottingham's probably the closest thing to home in the UK for me.
Oh, lovely. And can you please tell me what your childhood was like?
Okay, so I guess I grew up actually being like quite a child a shy child. I didn't really want to go to school. Interestingly, like I was it's quite timid. I'm always like fearful about my size because I'm actually quite a small figure. But I think I sort of slowly found my voice through being in choral speaking and being in drama club, and then I soon started to dabble in debating, and that's when I think I started to find my voice, and then got a bit more active when it comes to leadership, and have quite an interest in faith and culture as well. So yeah.
And you were saying that you initially started your degree in Malaysia. What made you apply for medicine, and then what made you transfer to the UK?
I guess I've always wanted to travel overseas. I think, well, UK was like my first choice, and I just quite like the culture, really. And interestingly, Malaysia doesn't have 4 seasons, and I've always wanted to experience that. So I thought, hey, let's go to the UK. And yeah, I'm glad that I came here, and I'm settling down quite nicely as well. Found my husband and got married, blah, blah, blah. So, and got a job that I have always dreamed of.
That's wonderful to hear. And with regards to your medical education, you've had 2 very different experiences through preclinical and clinical. Could you take us through what it was like, and maybe some differences between those?
Yeah, so I think I'm quite lucky, and I'm quite grateful to be able to experience the best of both worlds, I think. So even when I studied in Malaysia, a lot of the syllabus and the textbooks are actually based on the curriculum in the UK. Everything was delivered in English, but obviously, some of the conditions are more endemic, like tropical, for example, like tuberculosis, etc., in Malaysia, which obviously was probably different compared to the UK because of the demographics. So I just had to like slightly adapt to that. But most of my clinical years were obviously exposed to and I've experienced it in the UK. So just having to adapt, and I think halfway through medical school, trying to find my feet again. And it was a little bit challenging actually, because one, I uprooted myself and settled down in a completely different country, continent, and away from my support system. But also I think it has taught me to be a bit more resilient and adaptable to, the culture, surrounding me. And I quite enjoyed clinical years more than preclinicals as well. So yeah.
That's wonderful. And once you graduated, where is it taking you so far? Which hospitals have you been at?
I've always just worked in East Midlands. So I spent I did F1 in Queen's Medical Centre. I actually won the Foundation Doctor of the Year award for Nottingham University Hospital as well, which was quite a surprise, because I've always been a little bit insecure and was a little bit unsure whether I'm settling down well. But I suppose I think being a Muslim as well, one of the quite integral part of my faith is about serving, and on top of serving God is also serving His creations. So I just want to do good, and just be good at whatever that I do, and that means as a doctor and also as a surgical trainee. So I got involved in the Junior Doctor Council, and I've been involved every single year. And then F2, I moved to Pilgrim Hospital, so a district general hospital, which is quite different to QMC, which is a large tertiary teaching hospital. And then now, and then I applied for surgical trainee, and I got my probably top few options as well. And I'm now in Northampton General Hospital. So yeah.
So you started your core training in 2019, is that right?
I started my core trainee last year, so it will be 2020 August. Yeah.
And what was the first week of core training like?
It was exhilarating. It was just I think it was a mixed sort of feeling of feeling just thrilled, excited, but also very nervous because I wasn't sure because I've never actually been a surgical SHO. It sounds a little bit technical, but because of COVID, I had to spend about 8 months in A&E because the rotations were frozen because of the pandemic. So I was just so used to the hectic pace of A&E, and then but actually it suited me quite well. I was able to adapt to surgical training quite easily because I was just so used to the fast pace of things. But operating wise was quite it was a little bit intimidating for me because I didn't have a lot of much exposure to theater because I've just been in A&E for about 8 months. But I guess, you have to start somewhere, and yeah.
What challenges have you faced along your journey?
Right. So again, like I said, just transferring to the UK actually initially when I was a third year medical student. I remember I think I was doing an ENT placement at that time, and there was there were like flyers that were spread around and about Punish a Muslim Day. I think that was the first time that I encountered Islamophobia, and just feeling that my presence was not wanted by some people. And feeling like, because at that time during that placement, I was like the only Muslim in my group, and obviously because it was like a placement outside of like uni, so it was quite far away from my support system. I didn't really have anyone familiar to turn to, so I think that was a little bit. I think even until now, it will bring like some kind of like bitter kind of feeling and memories to that I felt. But I think I sort of just managed to look at the positive sides of things, and try to just overcome it by remembering, all the support from the positive people who surrounding me.
That's really
Can I also
powerful.
share another one with regards to the disposable hijab?
Well, I was just about to ask you, you've made a huge national impact with these disposable hijabs. You've
Yes.
challenged loads of institutions. Can you tell us about that?
Yeah, so obviously being as part of medical students on placement, and also being a doctor, we keep rotating to different hospitals. So different trusts have different local dress code policies, and a lot of them don't really mention about the provision of hijab in theater. And even when some mentions them, they didn't really mention it in an inclusive manner. So I always find myself to be struggling to maintain my hijab in theater. And so to the point that I was even pulled out from during one of the occasions I've actually been pulled out from theater because I had my hijab on, and they were questioning about infection control, etc. I just felt like it wasn't fair at that time. I felt like it shouldn't be that way, that if that is an issue, it shouldn't stop me from entering surgical career, because at that time I was an F2 applying for a core surgical trainee, and surgical training is going to be like 8 years long. So I felt like if I really want to do this, I want to make sure that it doesn't compromise my faith. So that's when I started to look for a solution that is both, safe from infection control point of view, but also, complies to my, religious prescription, basically. And then that's when I started seeing Miss Tierney, and then we start to work together towards finding a solution, which is the disposable hijab, which was introduced in Royal Derby.
And did you feel that you were being singled out? Did you feel that you were being treated differently from other people?
Yeah, initially I thought when I was a medical student, I just tend to just brush it off because I guess, because I was more into the surgery rather than everything else that's happening. But I suppose when I started to grow a little bit, more mature, a bit more older and more experienced. And also I have to mention a paper, published by BMJ, that showed that, more than half of, Muslim women actually face difficulties wearing hijab in theater, and a third actually felt bullied treat, it made me feel like I wasn't alone, and that, it wasn't just affecting me and I shouldn't really brush it off. And then that's a problem that, we need to find a solution for.
Hello, Dr. Roslan and everyone. Such an inspiring talk. So as surgical trainees, we get asked a lot about how to strike a work-life balance and keep ourselves motivated. If you could go back in time, what would you say to yourself to inspire or motivate your...
Okay. Well, I think I remember like the first week I was in F1 and I was actually in a surgical rotation. And I was talking to my friends how I really considered surgery as a career, but it felt like it was an impossible task because I couldn't find anyone that looks like me. But I wished that now that I'm in the surgical training program itself, I wish I could just go back to my old self and just give myself a big hug and just reassure myself that that everything's going to be okay. And if you can't find a role model, then you'll be the role model that you wish you have. So I think I'd probably say that.
That's amazing. There are a lot of stereotypes and assumptions made about surgical trainees, that there are certain surgical specialties that are more suited depending on your career priorities. So have you got any advice for medical students and aspiring surgeons?
Okay, so I think as medical student, right, the world is your oyster. Every time you go to a certain placement, just be open to possibilities. Like I initially thought I wanted to do cardiology for quite a while, and then I swapped into public health, which is like a totally different end of the spectrum. But I kept myself open to possibilities, and actually, I found that when I went into theater, I didn't really consider it till it's probably halfway through med school. That I realized I really enjoyed operating, and that's what I want to do, and I can't believe that someone would pay me for that. So I think just being open to possibilities, and just give it 100% in every single rotation that you go through, because more often than not there will be overlaps and there will be transferable skills anyway. So yeah.
Yet, here you are.